Pediatric Level 1 Trauma Center, a 5-year review.
Thank you. Good afternoon. Today I'd like to talk with you about pediatric ATV injuries. This is a slide that shows a picture of an 11-year-old boy who presented to the emergency room after an ATV injury. The handlebar had penetrated his chest wall, and what you see there is the lung protruding out of the wound. He was taken emergently to the operating room where he underwent a right upper lobectomy and ultimately did fine. However, this demonstrates the significance of ATV injuries. I'd like to tell you a little bit about the background of ATVs. They were introduced over 40 years ago, and they're a known contributor to injuries in children and adults. Approximately 30,000 pediatric ATV-related emergency department visits occur annually in recent literature, and over a third of all ATV-related deaths occur in children. Since their introduction in the 1970s, ATVs have evolved and increased in popularity, and the current ATVs weigh upwards of 750 pounds and can reach speeds up to 65 miles an hour. Despite this, they offer very little protection for the rider. The Consumer Product Safety Commission recognized this and entered into consent decrees with ATV manufacturers in the 1980s. However, this proved to have little effect on reducing ATV pediatric injury rates, and they expired in the 1990s. Therefore, we thought it would be important to review our experience with ATV injuries. The aim of our study was to review ATV injuries over a 5-year period at Children's Medical Center in Dallas, which is an American College of Surgeons verified Level 1 trauma center, and to compare that with our data from all trauma admissions. We reviewed the trauma registry for all ATV-related admissions over a 5-year period, and then compared that to data which was previously compiled from the trauma registry over a 3-year period for all trauma admissions. And it's important to note here that the trauma registry does not include data on patients who are not admitted to the hospital. These are some of the metrics that we reviewed, many of which you will be familiar with. More specific to our study was the use of protective devices and whether or not the child was a driver or passenger of the ATV. So we had 197 admissions over 5 years for ATV injuries with a male to female ratio of 2:1. In the all trauma group, there were just over 4,400 admissions over a 3-year period. The remainder of the data on this slide pertains only to ATV injuries. The mean age was 9 years, and as you can see, most of our patients were admitted to 2 services. At Children's, if you have unisystem injury, usually you'll be admitted to a specialty service, whereas if you have polytrauma, you'll usually be admitted to the pediatric surgery service. So you can see that 72% of our admissions were to the pediatric surgery service, with the next greatest number admitted to orthopedics. Interestingly, over 60% of our patients were transferred from an outside hospital. This graph depicts the percentage of trauma activations for each group. All trauma is shown in blue, and ATV injuries are shown in yellow. And what you see here is that 25% of all trauma admissions were associated with the trauma activation. However, this number increased to twice that amount, with over 50% of ATV injuries meeting criteria for a trauma activation. This finding was statistically significant. The next slide looks at the different types of trauma activation. At our hospital, we have 2 levels, alert and stacked. Again, all trauma is shown in blue, and ATV injuries are shown in yellow. And you'll see here that although ATV injuries were associated with a much higher percentage of trauma activations, the 2 different types of trauma had relatively same ratio of alerts to stats, with a ratio of about 5 alerts to 1 stat. This slide looks at their need for an operation, and what you see here is that 47% of all trauma admissions required operation, and this number increased to 60% with ATV injuries, a finding which again was statistically significant. This slide lists some of our other results. The injury severity score, as you all know, is a score that's used to assess trauma severity, and it's calculated after the patient has been discharged or has died. In the all trauma group, it was 7.94, and in the ATV injury group, it was 9.26. A finding which had high statistical significance. ICU, length of stay, and mortality were not different between the two groups. However, we were pleased to find that there was only one death out of 197 admissions in the ATV injury group. This is a little bit of data on protective devices. Out of all of the children that were admitted, just under 200, only 19% used any type of protective device. 18% of these were helmets and 1% were seat belts. This is in comparison to a study from 2004, which looked at one state that had no helmet law, where there was a 17% use of helmets, and a state where there was a helmet law, which had a 36% rate of helmet use. So this is twice that amount with a helmet law. However, it's notable that still about 60% of patients were not using any type of helmet. This slide looks at the age of our admissions, and what you see here is that the majority of our patients, over 50%, were 10 years of age or younger. Now, keep this in mind as I show you the next slide, which looks very similar. However, now you'll see the number of drivers in each age category shown in red. And if you ignore this box over here, where you would expect most children to be drivers, what you see over here is that over 50% of the drivers in our study were 10 years of age or younger. And if that doesn't surprise you or get your attention, look over here at the children who are 5 years of age or younger, where 10 of those children were actually driving the ATV at the time of injury. So in conclusion, though ATV injuries account for only 2.6% of all of our trauma admissions, they are associated with a higher number of trauma activations, a greater injury severity scale, and a much larger need for operation. In addition, over 60% of children are transferred from outside hospitals. Not only that, but ATV injuries are associated with over 50% of children less than 10 years of age driving, and in the 0 to 5 age group, or another way to say that is 5 years of age or younger, 28% of those children were driving the ATV, which is absurd to me. And not only that, but less than 20% of all of our children wore any type of protective device. And when you consider that these ATVs are now like mini cars, it seems that would just be unheard of. So I don't want you to misunderstand. We're not against ATV injuries, but we do think that the data that we've presented makes compelling the need to publish the dangers of ATV injuries and to educate parents, legislators, the general public about these injuries, about the proper use of ATVs and safety surrounding their use. And additionally, we could forge partnerships with ATV manufacturers and work to make these ATVs safer for those who are riding them. Thank you. I'll now take any questions.
What you meant to say is you are against ATV injuries, but you're not against ATVs. Is that correct?
Yes.
All right. Well, I want to recapitulate real quick. To me, this paper really reminds me a lot of the first paper of this session. And then basically, what you told me is that 20% of kids are wearing helmets. Then what Dr. Cheek said was that 20% of people who are driving drunk actually get some sort of legal repercussion. Both of these largely are educational issues. People have known for a very long time that drinking and driving is a bad combination. People have known for a long time that ATVs, are, particularly in children, are a risky undertaking. And so what do we do different? I mean, like I said, it's not as though this is a new revelation from a logic standpoint. The question is, I think, how do we make change? How do we enact a difference? And how can we be a part of that? Mike?
And actually, yeah, the point I was going to make dovetails along with what Mike was talking about. I mean, Moriah, by the way, nice talk. Nice project. My question was, you're talking about, we need to educate people, we need to promulgate the results. Hell, in Pennsylvania, where they passed a law saying you have to wear a helmet, 2/3 people ignore it. So if people are ignoring the law, you think they're going to pay attention to Moriah lecturing them about this?
No,
No, I'm serious. So right. What do you think? And my feeling questions about, laws in the government are well known in this room, so I'm going to stop before I get onto it. What do you think is actually the solution to this if you want to go back?
Sure, thank you for the question. I think it's a good one. I think the issue is that though we as a healthcare population may know about the risk of ATVs and their injuries, I don't know that the public truly understands the devastating extent of these injuries. I don't think that they know. Before I looked into this, I didn't know how dangerous they were. So I think we could do a better job at teaching the public about the things that can happen and ways that you can prevent injuries and reasons why young children shouldn't be riding them. In addition, I don't think that a law is necessarily the way to go. In Texas we have a law, but these laws pretty much only pertain to public property, and most of these ATVs are driven on private property. So I don't know, we can enact laws, but I don't know if that's going to solve the problem. I think more public education campaigns is the way to go.
Well, I would argue that rather than trying to do this on that front, the better way to do it is try and lobby to have these things not built to go as fast. It's an engineering solution, I think, more so than an education solution to these other folks.
Sure.
This is America. Yeah. You're gonna tell me what to slow things down. You're probably driving an electric car too, don't you?
I'm from a community where people give their 7-year-old an ATV for their birthday. And when I was your age, Dr. Kahn was always pushing helmet laws for bicycles because, correct me if I'm wrong, if a kid had a bike crash, they either lived or died based on whether or not they had a helmet on their head. I mean, because they bounce back from everything else that they can from traumatic brain injury. Did you look at specifically what injuries were involved? My impression is there are obviously a lot of traumatic brain injuries, which leads me to my second question. But there are also some lethal injuries that we didn't used to see when kids were just on bicycles. And then finally, did you look at out of hospital? I mean, how many kids die that don't make it to the children's pediatric trauma unit? That die in the pasture or die at a hospital like Lorrie?
Right. That's a great point. We did not look at how many children did not make it or how many died before. The trauma registry only looks at those children who were admitted. And we didn't look out there in the general public to see how many children did die out in the field related to those. Additionally, we did not specifically calculate out how many injuries were secondary to a spinal cord injury versus a head injury versus, abdominal trauma. But there were a fair amount of traumatic brain injuries and then multi-system organ injuries, as well as a fair amount of just fractures, isolated fractures. So it would be nice in the future to look at, where are the majority of our injuries coming from and what system are they related to?